As a podiatrist, the biggest thing that breaks my heart is seeing kids suffer with foot and leg pain. You know the feeling. Every bruise, every scratch, every bump, every knock, it hurts you more than it hurts them. And as a parent myself, I know exactly how that feels. If your child is suffering with pain at the back of the heel, it's more than likely that they have what we call Sever's disease. In this video, I'm going to help you to understand everything that you need to know about Sever's disease so that you can help your child get out of pain and back to doing what they love. What is Sever's disease? Sever's disease is the inflammation of the growth plate in the heel. In kids, as they are growing, their heel bone is not fully formed yet. Essentially, it's still in three parts. You've got bone on one side and bone on the other side, and it's joined together by the growth plate right in the middle. Think of it like a grilled cheese sandwich. So on either side, you've got the bread, which represents the bone, and with the cheese, that is the growth plate. The growth plate is made up of cartilage cells, which over time as the kid grows, gets converted into bone cells. And because it's made up of cartilage cells, the growth plate is not as strong as what a bone can be, which means that during this period of time, it is more susceptible to repeated stress, meaning that it gets injured more easily. Sever's disease occurs in kids from the ages of 8 to 14 and is more common in kids that are playing sports and are active. But having said that, it also occurs in kids that don't play sports. What we have found is that kids who have poor footwear or are on their feet for longer periods of time are more likely to develop Sever's disease. How do you know if your child has Sever's disease? Some of the things to look out for include them complaining of pain during or immediately after sport, things like redness, swelling, and tenderness around the heel, or even if you notice them having a bit of a limp after their sports and activities. In most cases, pain only lasts for a few hours and typically subsides by the next day. But in more severe cases, the pain can actually last for a few days or even a few weeks. Here's a few assessments we do in the clinic to know if someone has Sever's disease. First, we push firmly at the back of the heel. If a patient experiences tenderness in that area, then it's really likely that they have Sever's disease. Next thing we do is we push firmly on either side of the heel bone. Again, if a patient experiences tenderness in those areas, then it's also really likely that they have Sever's disease. The last test that we do is getting patients to first stand on their heels with their toes and the front of the foot off the ground, and then walking around the room for 20 to 30 steps. If this reproduces pain in their heels, then there is a likelihood that they have Sever's disease. But having said that, none of these tests are 100% accurate. If your child is experiencing pain in their heels during or after sports, then it's really important to get it checked out by a professional. What actually causes Sever's disease? Most doctors believe that Sever's disease is caused by having too much additional strain at the back of the heel. They think that when the calf muscle is tight, it pulls on the Achilles tendon, which then adds a strain on the back of the heel, thereby creating inflammation in the growth plate. But recent understanding has showed that Sever's disease is actually caused by repeated impact on the heel. Because the heel bone is situated right underneath the body, it undergoes a large amount of impact with each and every single step. This is then exacerbated by high impact activity like sports and running, but it's not always the case. In kids that have poor footwear choices, this also plays a big part. What are the best treatments for Sever's disease? In this section, we'll talk about some of the most commonly recommended treatments by a doctor, why some work, why some don't, and what is the most effective treatment for Sever's disease. So the first category of treatments that we'll introduce is what we like to call Band-Aid treatments. Band-Aid treatments are treatments that only address the symptoms like pain or inflammation, but not the actual condition itself. Painkillers, Panadol, paracetamol, we all have it in our cupboards. We've taken it ourselves, we've given it to our kids. This is probably by far the worst treatment yet. The reason I don't like painkillers as a treatment option is they actually mask the pain, and that is really, really dangerous. It's kind of like having a fire in your house with a smoke alarm ringing, but then deciding, hey, that smoke alarm is really, really irritating. So what I'll do is I'll just remove the batteries from the smoke alarm. So while the fire is going, there isn't an alarm letting you know that it's raging. So that's the same with your child's Sever's disease as well, which means that when your child goes on to play their sports and be active, they're probably doing more damage. Without the protective sensation of pain, they might be playing sports when they would have normally sat out, or maybe they might have continued playing through when they would have stopped much earlier. Next, anti-inflammatory medications. One of the most commonly recommended treatments are anti-inflammatory medications like Nurofen and ibuprofen. On the surface, it looks like a really logical option. I mean, anti-inflammatory medication for an inflammatory condition makes sense, right? But in reality, there's two things that make this not a suitable option. Number one, it doesn't really work that well. Whilst it deals with the symptoms of the condition, it doesn't address why the inflammation happens in the first place. And secondly, something that a lot of people don't know is the side effects of prolonged anti-inflammatory medication use. When used over a long period of time, the anti-inflammatory medications can impact on the way your stomach and liver functions. It's not really something you want your kids to be on, let alone for a really, really long time. Ice. The way ice works primarily is through an anti-inflammatory effect. What it does is when it's applied to an area, it causes the blood vessels in that area to shrink. When the blood vessels shrink, that means that less blood can get through to that area, therefore having an anti-inflammatory effect. But what a lot of people don't know is that ice needs to be applied at the time of the injury. And oftentimes with Sever's disease, ice is applied way too late. So what that means is when ice is applied hours after a sporting event or hours after a game, that means that it's only the numbing effect that is in play. So essentially, ice is kind of like a painkiller. But even if you've applied ice immediately after your child's sporting event, that means that you have the anti-inflammatory effect and the numbing effect as well. That still doesn't mean that it works. In fact, it's the same as both the painkiller and the anti-inflammatory. It still falls in the Band-Aid category, only dealing with the symptoms after the problem already occurred. Massages. Calf massages are very commonly recommended. The idea is when the calf muscle is tight, it pulls on the Achilles tendon, which then pulls on the back of the heel, which then pulls on the growth plate, causing it to be inflamed. But as you already heard, it's not really about the tension or the traction and the strain on the growth plate itself, but more about the repetitive impact. And massages don't address that. Stretching. Like massages, they also have a similar theory. If the muscle or the Achilles tendon is tight, then it's going to place more pull on the back of the heel. But like we mentioned earlier, it also doesn't address the repetitive impact on the bottom of the heel. Strengthening exercises. Strengthening exercises are very commonly prescribed by health professionals. Although its efficacy is questionable and its mechanism of action is not very well understood. Seated calf raises, standing calf raises, and single leg calf raises are some examples of strengthening exercises for Sever's disease. With Sever's disease, the growth plate is already inflamed, so it might be contradictory to be doing strengthening exercises as it can irritate and aggravate an already inflamed area. It's not to say these physical therapy treatments don't work at all. They do have some positive effects, but the reality is there's more challenges associated compared to the benefits that they provide. As you know, it's really, really hard to get your child to do anything. Clean their room, wash the dishes, do their homework. So it's actually even harder to get them to do their exercises. Oftentimes, kids are just not that motivated. And even if they are, they probably will forget. Or maybe they're just too tired at the end of a long school day. And as parents, it can be quite hard for you to remember to check in on them as well, seeing if they've done their exercises daily and it can put a toll on your time and energy as well. So we've discussed band-aid treatments that don't really work because they only address the symptoms. And then we talked about physical therapy treatments that aren't really that effective because they're based on outdated understanding on how Sever's disease occurs. So what are the treatments that actually help to reduce the impact on the bottom of the heel? Heel lifts, heel cups, and prefabricated insoles. So these treatments actually work to some extent. And the reason for that is that they help to reduce the impact that comes through on the bottom of the heel, which is the root cause of why Sever's disease occurs. For example, the heel lifts elevates the heel, therefore reducing the pressure that comes through. The heel cup cushions the heel, and the prefabricated insole supports the arch, which then takes pressure away from the heel. Researchers found that across these three treatments, there are similar levels of efficacy, but there is one treatment that is a lot more effective at reducing pain for Sever's disease, and that treatment is custom orthotics. What are custom orthotics? Custom orthotics are personalized prescriptive insoles that are designed specifically for each of your individual foot and tuned exactly to the way you move. In this study, researchers split patients suffering with Sever's disease into two different groups and provided one group with treatment of heel lift and the other group with treatment of custom orthotics. And what they found was really astounding. The group that was provided heel lift had a 30% improvement in their pain, but the group that was provided custom orthotics had a 90% improvement in their pain. So basically, the group with custom orthotics had a threefold improvement in their pain levels. The researchers believed that custom orthotics was so much more effective because they incorporate those features that we previously discussed. The elevation from the heel lift, the cushioning from the heel cup, and the arch support from the prefabricated insole. And not only did it combine all these three elements, it was also personalized and tailored to the contour of each patient's individual foot. But what about rest? Having your child reduce their physical activity and refraining from sport is an effective strategy. By doing that, essentially you're reducing the repeated and ongoing impact on the bottom of the heel, allowing the body time to heal and reduce the inflammation at the growth plate. The issue with rest, like some of the band-aid solutions that we discussed earlier, is that it's not really an effective long-term strategy. When they do eventually go back to sport, your child is going to use their feet again, incurring those repetitive impacts, which means that the pain will return. But what about not doing any activity until your child stops growing? This is a very common approach taken by a lot of parents. And because when they take this approach, their child's pain actually reduces or disappears, they feel like they are doing the right thing. But what they don't understand is some of the side effects or implications of taking this approach. When a child comes in for an assessment, it's really often that they would have tears in their eyes from the burden and the weight of carrying this disease. You see, it's not just the physical pain that the child feels when they have Sever's disease, but all of the associated things as well. For example, when they're not able to play sport, they often feel left out, and this affects them mentally and emotionally. Some common thoughts that kids have are, what is wrong with me? What is wrong with my body? And life is not fair. And parents need to understand this because this is a bigger issue than the physical pain that they feel in their heels. This ultimately affects their confidence, their self-worth, and can have a lifelong impact on their identity. When kids play sports, they don't just benefit physically, but socially as well. Being able to be with their friends, spend time with them, and do a similar activity together can be very beneficial for a child. When kids are unable to play sports, it removes the opportunity for them to develop friendship and camaraderie. This can lead to a feeling of loneliness and isolation. The final thing that kids miss out on when they are unable to play sports is the ability to develop their character. Traits like resilience, determination, discipline, and teamwork are all a big part of sports. In addition to that, they can learn how to deal with success and failure as well. When kids are unable to participate in sports, they miss out on these opportunities to learn, grow, and develop themselves even further. So, as you can see, when it comes to Sever's disease, it's not just about a child's physical well-being, but also their mental and emotional well-being, their social well-being, and their identity and personal development as well. I remember this story really vividly. It was a Wednesday afternoon, and John brought his daughter Jenna in for an appointment. Jenna had Sever's disease. We've seen so many cases of Sever's disease before, thousands of cases. But what made this story really memorable was because it's more about John and not Jenna. John also used to have Sever's disease, and during Jenna's appointment, he told me about his previous experience growing up. He told me about the excruciating pain that he had as a child. He told me about the emotional pain that he felt. He told me about the mental anguish, the sadness, the isolation that he felt. Whenever John felt pain in his heels, he would go up to his parents. Sometimes he would go to his mom, and sometimes he would go to his dad. He would tell them of the aching, the sharp pain, the discomfort that he felt in his heels. But each and every single time, his parents would say to him, "Oh, there's not much that we need to do about this. It's very normal, lots of kids have this, it's just growing pains." After a while, John learned not to go to his parents anymore because their response would always be the same. So what happened was he would just suffer in silence. Being in pain was one thing. Not being able to play his favorite sports and see his friends was another thing. But the worst of all was the feeling of isolation, rejection, and the feeling of being ignored. John wondered, do my parents even love me? Because of how he felt, it really put a strain on the relationship that he had with his parents. It wasn't until he became a parent himself that he realized how much his parents actually loved him. They were trying their best and doing what they saw right in their eyes. They were just simply misinformed and misled by their doctor. When Jenna complained to him of pain in her heels, John knew he had to do something, which was why he brought her in to see me. If your child is suffering with pain in their heels, then the first step is for us to conduct a thorough assessment to confirm if they have Sever's disease. We regularly have patients flying in from all around the world coming to see us here in Perth, Australia. If you want us to help you, click on the link in the description down below. We look forward to seeing you soon.